Thank you, everyone. You all have bios for these panelists, hopefully in front of you. So just for the sake of time, I'm going to run through them really quickly. We have Mariana Chilton here, professor at Drexel University. We have Dan Crippen, former director of CBO and former executive director of the National Governors Association. We have Dr. Kara Odom Walker, who is the current Delaware Department of Health and Human Services Secretary. And then Dr. John Wernert, who is the former Secretary of Family and Social Services from the state of Indiana, and you served in the Pence administration. So I just want to kick it off and ask you all, what was it that drove you to want to join this task force? And 9 months later, after we have our recommendations out, what do you hope that we have accomplished or that we will be able to accomplish moving forward with these recommendations?
I'll jump in. I joined the task force for 3 reasons. I was, as a public health professor, I tend to think of any kind of program that helps people who are poor and struggling as a public health program. It's an opportunity to create, in terms of public health, we think about creating the conditions where people can be healthy. And from my perspective and from my research perspective, on SNAP, it creates the conditions in which people can create a healthy choice. The second reason is I served on the National Commission on Hunger. I was the co-chair. That work was really tremendous. I wanted to be able to carry it forward, and I hope we can talk about some of those issues as well. And thirdly, because of my own research, I do a number of research studies in Philadelphia and really around the country about the importance of SNAP and its impact on the health and well-being of young children and their caregivers. And what I have seen firsthand and also through our numbers, I see that SNAP is an incredibly strong program. It protects young children from hospitalizations, improves stress, or it reduces stress in families and really helps to improve well-being. And I hope that we can talk more about that. And that's what we have been able to do in this report. There are lots of really great recommendations, and it really does establish SNAP as a strong program that has a great public health impact.
As a retiring budgeteer, I guess, I still have my card for the Green Eye Shade Society. I got interested long ago, and Bill knows better than I, that if we're ever going to address our federal fiscal issues, we're going to have to address health care. And it's Medicaid, Medicare, but it's also federal employees and veterans and all kinds of things. And so as I got more familiar with Medicaid, which was part of what I wanted to do to learn more, it became clear that we've tried lots of things to control healthcare costs, from global budgets to bundling to all kinds of things, and they may all have some good effect, but they haven't certainly bent the curve. And so I began to learn that nutrition was increasingly a piece of this puzzle. We have to give people better health if we're going to save healthcare dollars, not so much control the payments or other things. At least we haven't proven that. So I took this as a great opportunity to learn more about nutrition and its effect on health. And with the help of my colleagues on the panel, did exactly that. And how strong the evidence is between nutrition and health, and how strong the evidence is on sugar-sweetened beverages and health. And so, again, I learned a great deal. That's what I had hoped to do and certainly did.
Hi, everyone. So there are 2 reasons why I was excited to join this task force. One, I'm a family physician who has served underserved communities and minority communities for most of my career and felt like there were so many opportunities to better serve people by merging these 2 programs. And we do it in other places. And if we could really just have greater flexibility to focus on health in healthcare settings and address costs. My state is suffering from the consequences of growing rates of obesity and childhood lack of access to nutrition. We have 30% of people in our state who are obese, and that leads to higher costs. Our state has the 3rd highest per capita healthcare costs in our nation right now, and a lot of this is linked to the poor opportunities we have to really merge policies across SNAP and Medicaid. So I thought that was a very unique opportunity. 2, I'm a family physician, but also a health services researcher. And if we could break down the barriers to improved opportunities to look at data and inform both policy and practice, we could really create some very unique, innovative ways to merge these 2 worlds of making sure that the work that we're doing in SNAP Ed is really place-based, is in communities that are most of need. But right now I don't have that information to really inform better program making or inform better policy making.
Yeah, I would, to echo what Kara said, I'm also a practicing physician and a psychiatrist, and I've spent most of my 30 years working in what are called safety net systems, so inner city and rural health centers, safety net hospitals. And I've seen firsthand the impact of poor nutrition and obesity, not just on physical health, but also on mental health for our recipients and folks most in need. I also had the honor to serve under then Governor Pence as the FSSA Secretary, so I had Medicaid and food stamps, SNAP program under my portfolio, and was really kind of shocked at how poorly coordinated those two programs are, and many of our federal benefits programs don't coordinate well with our state programs, so there was clearly an opportunity to do better there. So I was really excited about joining the task force to be able to bring the clinician's perspective, what's going on at the actual point of care in terms of coordinating these benefits, and then also from a secretary's standpoint, what we can do better to coordinate with the federal programs on a statewide basis.
Great, thank you so much. Mariana, I want to come back to something you mentioned in your opening remarks. This is actually not your first time looking as part of a bipartisan task force at SNAP. You were the co-chair of the National Commission on Hunger, a congressionally commissioned group of folks. Could you lay out for the audience some of the similarities, but also some of the differences in what you all looked at as a group and then what this group looked at?
Yeah, I think what I'd like to focus on, when I was the co-chair of the National Commission on Hunger, and you can find our report if you search National Commission on Hunger or Freedom from Hunger, an Achievable Goal for America. In our commission, we were focused primarily on the root causes of poverty, and we were focusing on food insecurity and hunger. And of course, we brought in a number of many different issues, access to affordable housing, access to jobs, well-paying jobs, family structure, those kinds of things. I think where we really align with the task force, the work of the task force is really focusing on health and nutrition. And the two most important recommendations in this report that I think are very aligned with the National Commission's report is, of course, restricting access to sugar-sweetened beverages, which we know are very bad for health and well-being. But also creating, as a part of that, you can't think about restricting sugar-sweetened beverages unless you're also thinking about incentivizing the purchase of fruits and vegetables. And what that gets to is not only does that help to improve people's choices and improve people's health, but it gets to another underlying issue in SNAP that concerns, I think, all of us in the room, and that is that the research has shown, and we know from people who are on SNAP as well, that the SNAP allotment, the benefit amount of SNAP is actually quite low, and what it does is it forces people to make certain choices. And I can explain that to you also from my own research with families living in Philadelphia. I do a lot of qualitative work and quantitative research. But I've been in people's homes. I've seen how they make choices at the grocery store and the supermarket. And really there was a time when we were really thinking about the forced choice that families have to make when they're on SNAP. And that is, I think, exemplified by a woman named Angela Sutton from one of our programs called Witnesses to Hunger. And she says, Mariana, I know that eating wheat bread is better for me and better for my children. But when I only have a certain amount of dollars, of course I'm going to go for the white bread because it's cheaper and that allows me to stretch my food dollar. So a lot of times it's not necessarily that people are actively wanting to choose lower quality foods, but it's because of the forced choice that is happening with the SNAP benefit allotment. And that's something we thought about on the National Commission. We ran 7 hearings, open public hearings. We also received expert testimony from about 200 different people. And one of the things that was really important in those testimonies was how fundamentally important the SNAP program is, how strong it is, and how it helps us to strengthen the health and well-being of Americans, but that we can make many improvements. Again, by incentivizing fruits and vegetables purchasing, and also I think in our report, I hope you have a chance to read it, we do recommend that the U.S. government look at what would happen if we increase the SNAP allotment. Would it improve people's choices? Would it improve people's diets?
Great, thank you. I want to go to you now, Dan. You have a wealth of experience with states of all political stripes looking at Medicaid, and I know you've thought about, excuse me, the integration of programs, SNAP, Medicaid, and others. I was hoping you could share some thoughts on how at the federal level and at the state level we could be better coordinating all of these safety net programs to better help beneficiaries.
Thank you. As I mentioned before, the importance of nutrition in all these programs is become increasingly evident. There are over 70 million recipients of Medicaid today. The majority are moms and kids, where we clearly have to get nutrition to both of those, of course, to that group. The majority of dollars are spent on disabled and elderly. And of the most expensive patients in Medicaid, most of them have chronic illness, and as Dr. Frist and others have mentioned, very often multiple chronic diseases, with heart disease being certainly one of them, diabetes, high blood pressure, of course, in the worst cases of diabetes, blindness, amputations, other things. So they're not only very sick, they cost taxpayers and others a lot of money to take care of them. And so if we could improve nutrition, then we will help the patients foremost, and then the programs themselves. The linkages are, as everyone has said, weak, although Indiana has made some progress on applying for Medicaid and SNAP at the same time, which would help, I think, a fair number of people. There's still some very tough things to overcome. I didn't know, one of my fellow panelists told me, that the SNAP program has a waiver. And I'm very familiar with waiver programs in Medicaid, allowing the states more flexibility to better address their particular issues, but never those two waivers shall meet. So we don't have a joint waiver program, which you think would be obvious. And that's also true of other elements, as you mentioned, whether it's housing or other things, we don't coordinate those programs. And the common term of silos is very applicable here, although at the state level we call them cylinders of excellence. Nonetheless, you're all familiar with that kind of interactions. It can't happen. And so this report is replete with that. It has, I think, substantial evidence on the linkage of nutrition and health. And as been said already this morning, it would apply to for some of the rest of the population as well. But here we have a chance to use a federal program in a positive, meaningful way to help at least those people that we're responsible for in some ways to make better choices to promote nutrition.
And Kara, could you speak more specifically, as someone who administers both state and Medicaid out of the same agency in Delaware, what are some of these tools or flexibilities that you feel that you need that you don't currently have in your toolbox to best serve those in your state?
Yeah, as Dan said, there are so many opportunities because many of the SNAP recipients are also in my Medicaid population. And when we're talking about kids and we're talking about families and we're talking about the disabled and elderly, the opportunity to really combine those two programs would be tremendous. Right now, if we want to do that, it's really leaning on health systems to pay for food. But we could use Medicaid dollars and SNAP dollars to create healthy programs that are tailored to people who have diabetes or chronic heart disease or other conditions that would really benefit. I can't tell you how many times as a practicing physician, I'd have a patient in front of me who had congestive heart failure, and I'd say, lower your salt, see how much you're eating. We'd go on a home visit, and you realize they're stocked with canned goods that are shelf stable, but have lots of salt. So these are the kind of opportunities to really say, within that Medicaid population, how do we create food programs, health programs, do cooking classes for them that will really lower rates of consequences long term. And we've seen this in research studies where education around nutrition can actually reduce the burden of diabetes more effectively than medications. So I think that if we could have flexibility to either create joint waiver programs, to administer the programs together. Right now, my teams are in the cylinders of excellence. They don't coordinate. They're not allowed to share information. They can't even know who is in one bucket of funds versus another. And the administrative reporting discourages it. So I think that's a huge opportunity for states. Additionally, the data sharing, I have to plug this because if states could have additional flexibility to really focus on sharing information, that we could focus on social determinants of health, not just that we're spending a lot in Medicaid, but that we also are spending a lot in housing dollars in what we're doing around SNAP, in what we're doing around some of the other social services, and whether it's TANF, we could really combine some strategies that focus on health holistically and the whole person and the whole family in a way that would really make a bigger impact. Because we know that what we spend in the healthcare dollar, only about 10% of it is what we're doing in the healthcare setting with prescriptions and treatments and surgeries. Everything else really affects it. That 90% of the pie could be influenced through real strategic opportunities to leverage these dollars in a more effective way. So I think that those recommendations in the report are tremendous, but as the secretaries mentioned, it requires a little bit of work to make sure that the right committees are meeting together, because some of these waiver authorities are not just in the Farm Bill and not just with the Ag Committee, but we really need joint committee hearings as well to pull people together to say, okay, if you're looking at what happens in CMS waivers for your 1115 Medicaid waiver, you need to combine that with how you think about SNAP waiver authority.
I think you have the hardest job of anybody on the panel, and probably anybody in this room, trying to take care of Medicaid patients in a meaningful, combined way. Federal programs often make that more difficult than they should.
And John, I welcome you to reflect on any of the points that Kara just made, or your experience as a physician, and what could help you as a practicing physician help your patients.
Yes, absolutely. Well, of course, data and education, and people use those terms kind of loosely, but you heard the congressman say earlier, what's the education, what's going into the recipient's mind? I would also speak for what's going into the provider's mind, because at the point of care, we ask a lot of our primary care providers, particularly when they're taking care of at-risk individuals with multiple disease processes. You know, they're worried about meaningful use and completing the EMR and making sure they check the prescription drug monitoring program. All these requirements don't really leave a lot of time to be talking about sleep hygiene, nutrition, all the things that really do matter, those social determinants that Kara was talking about. So I think the data that we give our primary care physicians, particularly in community health centers, needs to be, whether in the task force report refers to store data, but also at least having some indication of what the patients are actually consuming, because it does profoundly impact their health. And so the data is important, but the education, I would dare say, most of the providers out there have a very superficial understanding of what the SNAP program is really about. And the SNAP Ed portion of this, passing out brochures at community health fairs is okay, but very little of this education is actually happening in community health centers or in FQHCs, where the vast majority of not just Medicaid, but SNAP recipients receiving their care.
All right, so I'm getting the hook over here as well. I just want to give you very quickly, each one of you, taking with what we've done today over the last 9 months, if you could look 2, 5, 10 years down the line, what are some issues that you think we should be looking at next? What are next steps for this? And we can start down there with you, John, and come back the other way.
Sure. I agree with Dan completely. We need this idea of portfolio budgeting, being able to take any of the programs related to nutrition and to health and budgeting those in a more global way. At the state level, that makes a whole lot of sense. So giving the states the flexibility to start looking at portfolio budgeting for health and nutrition would be a huge step forward, and something that I think states like Indiana and most of the Midwest states would gladly take on.
I see the future as really embracing technology, and whether it's talking about how we pay for things and track things. I mean, our stores have information about everything we do and purchase, right? They're feeding us coupons when we make purchases. Well, those same ideas and ways that we can leverage technology should be embedded in policy making. We don't have that information at our fingertips when we're trying to figure out what segments of the budget should be shifted towards better health education, towards better health. And I think that's a huge opportunity. People are using their phones, they're using the smart speakers. There are so many innovative opportunities to really leverage the data that we have and feed in tools around choices that we make subtle nudges when we're shopping in stores. And I think that is really where the future needs to go.
I think there's not only a great body of evidence that we've cited in the report on the linkage between nutrition and health, other things. That education, that knowledge is going to spread. Certainly as of 10 years ago, I didn't understand as much about nutrition and health, and I think others are beginning to learn that. We see more and more written about it, both in the kind of the popular press, but as well as in scientific journals, in health journals. We're now seeing articles. So I think over the next few years, we need to do what we can to expand that knowledge, and that's one of the reasons we suggested in the report no spending of SNAP dollars on sugar-sweetened beverages, because it's clear that that's a link to health. And we just need to make, I think, that education more clear, and a lot of people will respond, including SNAP recipients. And we need to, of course, make sure they have the options of getting nutrition. One point that I think we may not have quite made clear here, but we did in the report, is that we're not saying that anyone should not buy whatever they want to buy. What we are saying is, at least with SNAP dollars, like alcohol, we probably shouldn't be able to use those dollars for things that are clearly hurtful, not healthful. And that's what we're trying to do here. So we're not trying to ban anybody from buying sugar-sweetened beverages, just not with their SNAP dollars.
I agree with everything that's been said, and I think that what makes it so exciting with the Farm Bill, whether it's this year or next year or when it is in the future, is that we have been able to help people get focused on SNAP as a health program. And I think it could serve as a model for any other kind of large bill that's coming out on the Hill, whether that's dealing with veterans, with people who are aging, our seniors, whether that's with TANF, temporary assistance for needy families. What it does is it helps us to see that there's health in all policies. And those of us who are thinking about public health and the well-being of young children and families and of our elders, I think if we can see all times that policymakers are working on the Hill, that they are having an impact on health. And this is one of the first steps in doing that.
Thank you. Well, at this time, I'm going to invite the panelists to stay. I'm going to move over to the podium. The secretaries are going to rejoin us. If you have any questions, please raise your hand. We have a couple of roaming mics, and so wait for the microphone to begin your question. And I just want to note that we also have task force members Lori Witzel and Angela Rashidi in the audience, and so they can also answer any questions during this Q&A. Secretaries? I know this is not a shy group.
Hi, I'm Deborah Beckman. I guess you guys have talked a little bit about what of your recommendations you think like Congress might be more open to. I was curious if you kind of have thought about or considering sort of a strategy for dissemination to Congress or the administration, and what that might consist of, if so.
I would just say that the BPC does have a strategy for follow-up and for educating Congress, and we have a 501c4 where we can do that, and we intend to do that. So, and the report has been disseminated or will be disseminated not only on Capitol Hill, but there's a lot of other parties that might be interested, states, communities, corporations. Many of them are much more actively involved in the health treatment of their employees, and so there's a whole world out there that can learn from this report. But yes, we will disseminate it to Congress.
Hi, Andre McAdams. I was wondering if over the time you guys spent together, if the task force had the opportunity to maybe discuss the issue of like access to SNAP in terms of, I'm thinking specifically in DC, where in Ward 7 and 8, there's like one grocery store for all these people to attend. So, you know, saying what they can get when they get to a place to redeem their SNAP benefits is one thing, but if they can't actually get there or there's not an opportunity to redeem them, that's another. And then I'm also wondering if maybe over this time, we talked about how Harvest Box might not be the greatest opportunity, but maybe that there's been a lot of studies done and pilot programs done talking about medically tailored meals and about how, especially with Medicaid, there's a subpopulation that we've talked about, like super utilizers, and how that chronic population might benefit more from medically tailored meals that can really help them improve their health. So I wonder if either of those things were talked about.
I can jump in on the medically tailored meals, and that we did talk about also access to good grocery stores and supermarkets as well. In terms of the medically tailored meals, in terms of the National Commission report, we had some strong recommendations there that Medicaid and Medicare should be providing funding for medically tailored meals for people who are nutritionally at risk, for people who have diabetes or cardiovascular disease. And we know that that actually directly reduces healthcare costs, and that's something that we ought to be looking for in the recommendations in this report in terms of looking for waivers where that can be accomplished. So yes, we did discuss that, especially in a very targeted approach to those kinds of meals where people can get meals brought to the home if they're homebound or if they are very ill. I don't know if anybody else wanted to talk about access to grocery stores and things like that. We didn't discuss it great length.
We did, yeah, we talked about it a little bit. Obviously, it's very important for some urban areas and obviously rural areas. And so we talked about access as being another piece of this. But we didn't spend a lot of time. Our focus really was on the linkage between nutrition and health and how we might improve programs to get better nutrition, the federal programs. And there are, of course, other programs out there that come to play a lot, Meals on Wheels and other things that can be coordinated.
And Double Up Bucks, which are now part of the Farmers Markets program. And the Farmers Markets program have grown considerably. I mean, it's not the exclusive answer to the problem, but yeah, I think this question of access is a really important one, and a lot of the anti-poverty groups are really looking at that as well. It wasn't the specific focus of our effort.
As a state policymaker, the issue for particular communities is very important and hits home. So we talked about it briefly, and I think that's why it's so important to lean on state policies and flexibility so we can really create programs that will address these needs that are community specific. And we talked about Double Up Bucks, but also providing flexibility for incentives to have farmers markets located in places that don't have access to fresh fruits and vegetables, or partnering with stores in unique ways, because many of these urban environments do rely on corner stores where, you know, sugar sweetened beverages might be front and center, but there's no real high quality produce located. And so we talked about if we could have kind of an incentive to have programs tailored in that way, that could be very beneficial. And then also the additional flexibility with SNAP Ed could also help create kind of relationships and channels to support communities like that where there really are food deserts, and lack of transportation presents a huge barrier.
Let's go up front, and then we'll go back for the next question.
Stacy Bridges, Veterans Vision again. This harvest box is disturbing. It reminds me of the bread lines in World War II. My question is, if we were to go forward with the harvest box, how could you assure that the food that's in that box would be healthy and sustain the time that it's going to be setting, because it's going to be setting before it's actually distributed? And who's actually going into that box if we do something like that? And what are their incentives to do this? And also, First Lady Michelle Obama had the Let's Move program where she talked about nutrition and educating the kids, but we also have to go back into the schools to make sure the schools are funded as far as gym classes and home ec and so forth. So what are we doing as far as supporting our school systems so that they can educate our kids and make sure they're active in school?
Well, I think you might have to ask the administration about the specifics on their ideas for the harvest box. As we noted, our deliberations were essentially final before that proposal came out. If anyone has any last general thoughts?
The only thing I would say is, in terms of SNAP Ed, which I think one of the heart of this report is how to strengthen it to make it meaningful. I think my colleague from Indiana talked about, you know, it's okay some places, not very good in other places. We didn't really talk about the role of the media, the role of marketing and advertising, the amount of food that's marketed and advertising still to children, the number of people, lower income people who watch a lot more television than than maybe the general population, what's advertised there. I mean, there are so many factors that go into this issue of what people eat. And we thought on one of the most important factor, but there are a myriad of factors that make up the part of the solution here.
Hi, good morning. Nancy Brenowitz-Katz with the Alliance for Healthier Generation. This is kind of back to the previous answer, Dr. Odemark. You started talking about stores and offering healthy foods. I have recently been learning more about SNAP and started to learn more about the SNAP stocking requirements and how, although we want lots of healthy foods in stores for SNAP participants, they're very complicated for store owners to implement. So I was just wondering if you all talked at all about sort of support for store owners in being able to, offer those healthy foods and in particular procure healthy foods, because small stores are also challenged with some of the same issues that our participants are challenged in terms of our food distribution systems.
Spend a little bit of time talking about the role again of advertising and procurement, and especially when we were talking about the sugar sweetened beverage recommendation, that was a big part of it, because maybe at first you think, well, we shouldn't restrict choices, but then when you realize how many incentives are built in to make sure that sugar sweetened beverages are front and center and really marketed towards particularly vulnerable minority communities and children, we really are playing a role, even if it is less visible. So we wanted to figure out a way to kind of bring stores in and figure out how to best partner, but there's a lack of coordination there, and probably a role that we should all play in creating incentives to support the purchase, again, of healthy produce, especially in these smaller market venues. It's, not only the large stores that have the ability to really change behavior, but there are others on this panel who are more expert than I in how that really could work, but we certainly spent quite a bit of time talking about it.
Well, and I also say from a community level, we don't want to increase the bureaucracy and the regulations and the rules for the stores, but at the same time increase the flexibility. So instead of food trucks, why not farmers market food trucks? Actually go out and spend time in these food desert areas, and sometimes they're actually sitting at the community health centers or at the convenience stores that are SNAP providers, but at the same time can't really provide all the fresh fruits and vegetables they need to. So it provides some innovation there with partnerships in the communities.
Great. Well, I think we have time for one more question. Anybody? I'd like to, last question.
Do I use the microphone?
Yes.
Hi, my name is Sarah Beckwith, and I am with the SNAP Ed program at the state level in the District of Columbia. Had a question, if you could briefly elaborate on suggestions how programs at the state level can collaborate to optimize programming.
I'll try that first. We've talked about the various silos in these programs with an emphasis on the federal government because that's what we were about. But the states often mirror those same silos because they have federal programs to which they apply, federal regulations to which they have to adhere. And so we have the same phenomenon at state levels, as Kara has seen, with not just nutrition and food, with Medicaid, with housing, with other things that aren't coordinated very well. And Delaware and Indiana are exceptions, but in many states we would hold meetings in the governor's office and invite a range of people that seem to have some effect on Medicaid but health. And some of those folks had never talked to each other before, simply because the incentives to coordinate are minimal. And that's why I think when we emphasize things here, we talk about the interplay, not just of Medicaid, but other federal programs, and states need to mirror those as much as possible in order to bring services to not just Medicaid, but SNAP recipients and others, and in a way that helps them and helps their health, as we were talking about here. So states need to coordinate a lot better, and they need to have a lot of help from the federal government to do it.
I would just add one more thing. This is probably not as true for DC, but there's two other communities we haven't really mentioned today. One is the medical community, the role of physicians and healthcare providers in being part of SNAP-Ed. And the other is the farm community. After all, it is the producers who actually raise the crops and livestock and other things that people eat. And they have a big role in this. Farm bills can have a big difference. For example, in recent years, farm bills have made it a lot easier to grow fruits and vegetables because they've been able to get risk management products, insurance products, that historically only went to certain program crops. And so there are so many communities that could be involved in making SNAP-Ed much more successful, but as Dan said, they have to be done holistically.
At this time, I'd just like to invite Secretary Veneman, Secretary Glickman, Senator Frist, if any of you all would like to make final remarks.
I just made mine. All right?
Well, again, I just want to go back to something I said in the beginning, and that is the importance of really looking at SNAP as a public health program, not just a food insecurity program, because we know now that it's not just about calories, it's about nutrition and it's about nutrients. And we're seeing this in the healthcare system all over this country, that we have more non-communicable diseases that are costing us more and more in terms of the population generally. But when we have an opportunity to spend dollars out of a federal program like SNAP, let's make sure it's being done in the most effective way possible, providing the biggest health benefit that we can possibly get.
Well, as I said, with the opening, it would be a productive 2 hours, and I think it really has been a productive 2 hours. We've all learned a lot, and it's been based on the 9 months of consideration among the task force members, the co-chairpersons, and then about 50 other meetings that were held to solicit input from people around the country on this particular issue. And as I've listened to it from a medical standpoint, I continue to see the huge cost that we're spending by health unnecessarily in this country today. And in part, it was based on ignorance. At one time, we didn't know smoking as bad as it was, and we'd put smoking and gave them to our military personnel and the cigarettes. And as we've learned with science, and increasingly we learn every week, we see that there are opportunities that we as policymakers, even if we're 2 or 3 degrees removed from true policy making here in Washington, have an obligation to inject what we know in science with the impact that it has on the individual well-being of every single person here and their children and that next generation. And that's what this task force has been all about, to take current sort of evidence-based information that we have out there today. We know the populations are very well defined. We know the amount of money that all taxpayers are putting into Medicaid, where most of the SNAP benefits are being received. And we know under the current structure that we're hurting them. We know that we're hurting the recipients. We know that they are getting nutrition and offered healthy choices by financial incentives in some way, but we were actually hurting the health, creating in a very constructive way an obesity problem that can only be dealt with by more pain, more suffering, more money, more spending. So when you put it all together, I am really delighted in this task force, which did come up with an idea about 2 years ago to link this together, to not give not try to reinvent SNAP at all because it's such a great program, but to bring it up to modern times, to modernization. And when we look at breaking down silos, being able to inject healthy choices and nutrition into federally and state-funded programs based on 21st century knowledge that we have today. And from the questions, which were brilliant questions, it will extend to things like meals, Medicaid. As one policy, such as we're pushing people out of hospitals on day 1 or day 2, and they go home and they live in a food desert, or there are gangs around, it does make sense, once again, to come to nutrition, to give healthier meals of some sort, Meals on Wheels or other for-profit programs that are out there. All of that centers on what we know today that we didn't know 5 years ago or 10 years ago, that nutrition matters. It matters at the pocketbook, but more importantly, it matters at the health and the well-being of every single American alive today. So thank you all very much for being here and participating in this discussion.